Great pleasure that I get to introduce today Dr. Vivian Welch and Christine Matthew. Vivian is a PhD and co-director of the Cochrane Campbell Global Aging, and most recently, big congratulations to Vivian. She's been appointed the first full-time editor-in-chief of the Campbell collaboration. So congratulations, Vivian. She's director of the Method Center here at BRI, and she's an assistant professor in the School of Epidemiology, Public Health, and Preventative Medicine here at the University of Ottawa. Her research interests revolve around science and the practice of conducting patient-centered rapid reviews in response to decision-making needs at Bruyère continuing care, and to support patient-centered care based on the best available evidence. Christine is a research assistant here at BRI, working with Vivian and Kevin Potty, and she has a background in aging and health and philosophy. Her research interests, among many, include aging and health and palliative care. So, Vivian and Christine, welcome.
Okay, we're going to do a tag team. So Christine is going to do the second half of the presentation, and I'm going to cover the first part, introduction. So thanks, Doug. I have to keep within this square on the floor. So I'm going to tell you a bit about some research we're doing as part of the Cochrane Campbell Global Aging, really to set priorities for where this group is going. So I'll tell you a bit about what we are and where we want to go, and Christine is going to tell you what we've been doing to develop what we call evidence gap maps. I think, so conflict of interest, I always declare that I have these positions because, you know, as a co-convener of Cochrane Global Aging, of course I want to promote it, and that helps me when I promote it. Same with Campbell, and same with the Cochrane and Campbell Equity Methods Group, and Christine has no conflicts of interest. Just want to say we received funding from the Canadian Institutes of Health Research for a planning grant for this work. So, like Bill, this is not a very expensive project. So what we set out to develop this Cochrane and Campbell Global Aging in about August last year. Registered it with the Cochrane collaboration first. And the idea was to become a sort of hub for knowledge and evidence about aging. So to disseminate and promote the reviews, but also to, you know, show where we need more evidence and more systematic reviews. So since I'm now editor-in-chief of Campbell, I can declare my conflict of telling you what Campbell is before I tell you what Cochrane is. So how many people here know what the Campbell collaboration is or have heard of it? Okay, almost everyone, but some people are brave enough not to put up their hands. So the Campbell collaboration is an organization dedicated to systematic reviews about social policies. So it's named after Donald Campbell, who was a social scientist who maybe is most famous for a book about quasi-experimental research designs, experimental and quasi-experimental research designs, Shadish, Cook, and Campbell. But he was also known for arguing that the way that evidence is developed should go through a process of validation through experimentation, and he had this term, the experimenting society. So maybe, you know, in 10 years we'll be able to prove Bill's hypothesis about, you know, the association of networks and neighborhoods with health. So Campbell collaboration has started in around 2001 and has 8 review groups, and they're dedicated to social welfare, crime and justice, education, international development, and has new groups on disability and knowledge translation implementation. But the reason that aging is a part of this is really the social welfare issues related to aging, so social care. Cochrane. How many people know about Cochrane? Okay, like everyone. Okay, good. So I don't have to tell you too much about Cochrane. So Cochrane was, was named after Archie Cochrane, who maybe some of you don't know. Archie Cochrane once had a sandwich board. Do people know what a sandwich board is? So they have this thing on front of their body, and he walked around in front of the National Health Service and said all effective healthcare should be free. And he was also known for promoting, that we should have a database of what works in healthcare. Cochrane has 52 review groups, and these are now, maybe some of you don't know, being merged into 8 networks. And 2 of these networks are devoted to long-term care and aging, and also has networks on family and children, and on public health and health systems. So there's a lot of content in the Cochrane Library related to aging. So why does systematic reviews matter? You probably can't read this, but it says it's an interesting phenomenon. Every time I press this lever, the postgraduate student breathes a sigh of relief. So just like Bill said, so it was a great introduction. Is that correlation is not causation, and systematic reviews, take high quality evidence, and that's not just randomized trials. It depends on the question. What's the right type of evidence for the question, and sort of summarizes them in a systematic way. So that's why we think we need systematic reviews. This is a kind of long list of things that our global aging group has done so far to promote global aging. Very happy to be based partly here at Bruyère, which is a great fit with our mandate. My 2 co-directors are Tracy Howe, who's based in Glasgow in Department of Rehabilitation, and Sue Marcus, who works with the Cochrane Dementia and Cognitive Impairment group. So we've had a lot of interest from the WHO, which has just launched a strategy for healthy aging. And they see this very much as fitting in their mandate of developing reviews, particularly on aspects related to promoting healthy aging. And so we've attended, I think, 3 meetings already at WHO about planning for this strategy on aging and how systematic reviews could be a part of that. This is impossible for you to read, but a colleague at WHO actually pulled out for us how many Cochrane reviews related to topics of aging were cited in WHO guidelines. So something like 700 guidelines cite Cochrane reviews across all the different areas of aging. And a lot of those are focused on healthcare, as you probably can imagine. So a lot of them are focused on preventing or treating cardiovascular disease, dementia, mild cognitive impairment, other conditions associated with aging, like leg ulcers and things like that. I'm going to just skip this slide. So what we've started out with this project that Christine is going to mainly tell you about is something called Evidence Gap Maps, which is a new product in the Campbell library, coming in about a month or so. And what it is a map of all the available evidence on a particular question, and usually in a broad area. So what we set out to do is to ask, and it was partly motivated by the WHO, to ask what systematic reviews already address questions related to healthy aging, and how could we decide which ones are most important to do next. So one thing we did, the WHO did, our colleague Ritu Sadana ran a survey on priority setting for healthy aging, and she's actually got the results of this and is going to publish it. I haven't seen them yet, but this is mainly focused on primary research related to healthy aging, so what kinds of new studies do we need? And what we're doing are evidence gap maps, so I've already told you these are really intended to inform a broad question about what research is available and what research needs to be done. And I want to show you one example, and I think Iman is going to help. Can I just select it? Okay. So So these maps, this is sort of what they look like on screen. And they have, I'm going to walk you through it because it's pretty complicated, and you can ask me questions anytime. What they try to do is to set out the interventions along one column, and then the outcomes and different categories of outcomes across all the columns. And what each of the dots shows you is the amount of evidence available for that question. And it also classifies in the gray dots, I think, are the primary studies, and the red ones indicate that there's a systematic review, and all the systematic reviews are quality assessed so that people know whether it's a high quality systematic review. It doesn't tell you the direction of effect. You would actually have to go in and look at the review to find out the direction of effect. But for example, if you were interested, this is adolescent sexual reproductive health. If you want to look at, for example, financial incentives, and this row here is vouchers and subsidies, then you can see that there's some available evidence in the adolescent knowledge, adolescent behaviors, and then you can start to see gaps in some of these cross-cutting themes, so effects by sex or effects by marriage status. So there's not very much evidence about whether these schemes work differently in different populations. So it gives you a broad overview of what's available to make a decision, and also some of the sort of blanks give you some ideas for where there are gaps that you might need new research.
Yeah, just the size of the circles, does that refer to the number that are available or citations? Yeah.
Yeah, exactly. And then what you can do at the top here, and policymakers love this, managers, policymakers love it, you can filter by different regions, by countries, by study designs or populations. So, for example, in aging, you might filter by people who have dementia as an important population. Or you might filter by a setting, long-term care setting or something like that. So it's kind of a snapshot of what's available, and it also, I think for the research idea, it really helps to think about which outcomes are being assessed most commonly in these kinds of studies. And especially with aging, with the concept of healthy aging, WHO is very interested in functional capacity and identifying what do we know about these interventions improving people's ability to stay home, to participate in society, and to function in society. So I think Christine will get into some of those gaps. So that's kind of the idea. So now I'll have to go back somehow. Okay, and so I should say these evidence gap maps really started with an organization called 3IE, which stands for International Initiative for Impact Evaluation. This organization is very connected with policymakers in low middle income countries, and the idea of these gap maps really came out from discussions with policymakers about what they wanted to know about systematic reviews, which is what's available to answer my question right now, and what kind of future research should I commission? Should it be primary research or should it be systematic reviews? And so when you start to see large circles with a lot of primary studies, you might think this is a very ripe area for a systematic review to bring the evidence all together. Okay, so with this in mind, we developed a planning grant for CIHR. We had also submitted it earlier to the University of Ottawa as I can't remember the name of their program, but a sort of seed funding grant, which was unsuccessful, but this one was successful. So 2 tries. All you people have to be persistent. And a lot of our co-applicants are in the room. So Barb is a co-applicant. I'm sorry I haven't seen this yet, but it really it really is in development. And Jason and Kevin. So as part of the motivation of this and the reason to bring on a number of the colleagues here in Ottawa is that at least we saw this as an opportunity to bring together people interested in aging research in Ottawa about what we could do more together. And so that was the motivation to bring Barb in from a deprescribing perspective and Martin Bilodeau in from a more physical function and frailty perspective. So we could sort of collectively get together. And I think I'm going to pass it to you now, right? Yeah. So I'm going to give you the tools. I'm going to get out of your way.
So for our evidence gap map, we decided to focus on care for older adults. Initially, you saw the large table that you couldn't really see with all the guidelines. A lot of those addressed pharmacological interventions for older people, but we wanted to go more broadly and capture the social and health interventions for older adults. So the framework is the foundation for evidence gap maps. We have the outcomes that you saw that are the columns, and then the interventions. The framework allows us to present the interventions and be able to classify them in a way that's intuitive, that's easy to understand. We decided to go with the International Classification of Functioning Disability and Health, using their framework of body functions, activities, and participation as ways to classify the outcomes. So in this table, you can see like mortality, morbidity, that would go under body functions and structures. Activities, functional ability, intrinsic capacity, which include activities of daily living, self-efficacy, and then in participation, quality of life, social participation, people's ability to work, and also caregiver outcomes. For interventions, we adapted the UN Sustainable Development Goals that are listed over here, as well as we used the Health Age report from 2012 that kind of provided narrowed interventions or narrowed areas of care into three: so access to quality health care, income support, food security, and enabling environments. And we decided to well, we're still developing this, but we thought it would be nice to divide care settings into long-term care, care provided at home, in the community, and assistive technology. So this is what the rows would look like on the gap map. And if we put it together, of course, the body functions would be subdivided into the different outcomes. So the map would be very large. So this, the next 3 slides, these are based on an initial search we conducted in September on assistive technology, and the next 3 slides were on care interventions. We identified a few that met our criteria, so the inclusion criteria was based on the framework we have developed. And you can see how each of the reviews, how they fit into the different outcome categories. And then it also identifies areas that aren't populated, that don't address that particular outcome. This is for community care settings, long-term care. Yes, so our initial search was just done in Cochrane, but we are planning to expand it onto Medline, PsycInfo, CINAHL, and look more broadly to capture all the evidence, all the different interventions that are available example for care for older adults. In our searches, we used text words and mesh terms. So this is an example of a search strategy that we used for just care interventions. It yielded 85 results, and for assistive technology, out of the 1,082 results, we included 26. So going back. We will be using the help of a medical librarian to use a validated search filter to enable that, to ensure that we actually do capture all the interventions and properly tailor the searches to the population as well. And the framework is, again, we're still developing it, and we definitely would like your input on the framework, on what other areas that we should cover, on outcomes that we may have missed, and search strategy suggestions. So now, welcome any questions. Yes.
Thank you. That is very interesting. Do I understand correctly that you would be able, a user would be able to go to the box that is of interest, click on it, and then you will have populated that, and we'll see all the relevant.
Exactly.
That could be really take a lot of time. Do you? So this would help you if you were trying to decide whether you wanted to do a systematic review. You could find out if someone had already done it or something. But it would also help you if you were trying to do less applied research and more basic research to kind of inform yourself about what's been done. That's right?
That's the intent, yeah. And depends on the purpose of the maps, how far into the primary research you want to go.
Yeah.
So we actually, because our purpose was really to inform systematic reviews and also dissemination of the reviews, we felt we would start with reviews, and a later step might be to map the primary studies, so the primary research. So there's kind of different approaches to doing it. But it is people, researchers and policymakers look at it and say, I wish somebody had done this for me about 10 years ago, right?
Yeah.
So it's a very compelling tool. And then one thing that's nice is the sort of the outcomes, the thinking about the outcomes and what are the important outcomes goes into the process before, getting into the evidence. So, for example, we really think that social participation and economic and labor outcomes, caregiver outcomes, should be part of these kinds of studies and research. So that's kind of the motivation for using the international classification function, because it does have that built in. So it's also helpful in thinking about what are the outcomes that people should be measuring in these kinds of studies.
Are you going to produce some kind of analytical tool that's going to automatically add new systematic reviews and keep this up to date, or are you going to have to do the work of keeping it up to date in a sort of more manual way?
Yeah, so they're pretty new, so that hasn't been developed. In Cochrane and outside of Cochrane, there's a lot of work going on now with automation, and what can be done automatically through text mining, particularly with screening the results of searches. And so those kind of tools, in probably a few years, could be applied to update something like this, because there isn't a lot of analysis in this. It's really identification and then population, right? Identifying a review and then populate into the right interventions and outcomes. So quite a lot of it could be automated, but right now I don't know that anybody's working on that for this kind of map. So it would be something that would be updated, hopefully. depending on funds and energy
Mhm.
and so on. But I think for Cochrane Global Aging, we're just starting up, so we don't have what would you call it, core funding right now. But this is one sort of first step to show that we have some value and some ideas. So I think in the core funding might be an idea to build in some funding to update this.
So I'm thinking about all of the evidence gaps in the area of deprescribing, both in terms of the evidence that's needed to actually develop a deprescribing guideline, as well as the evidence of the impact of implementing a deprescribing guideline. So is that intervention deprescribing, is that one that you're planning to include as a category?
So we had initially planned to include it, and then in discussing what were the kind of questions that WHO had and that we wanted to start with, we started with the sort of enabling environments, which maybe you could say deprescribing is an enabling environment in a healthcare or long-term care setting.
Mm-hmm.
So so potentially we could include it, but at the moment it's not in there. So we didn't include deprescribing in those facts. But
maybe that could be something for discussion at our symposium in March. Should we do that? How would we do that?
yeah. Because I think it's a very focused area, so you could actually get the body of literature pretty quickly, and it would make it's a nice snapshot of what's available and kind of where the field is going. Okay, for March. Any questions?
If there are no other questions, I don't want you to think that I'm being, I'm definitely going to be politically incorrect.
That's
But,
good. That's what we want.
But I don't mean it as a joke. Okay? So in the news yesterday was an announcement that the guy in charge of analytics for the Trump election team had been trying to get Clinton's emails from WikiLeaks. And of course, everybody's just totally grossed out about this for all sorts of reasons. But if I understand correctly, what he wanted them for was he wanted to put some kind of structure under them so that anyone who wanted to, could go to the exact email of interest to them. So it almost sounds the same in the sense that there's this work that gets done to sort data that then allows the user to have this really smooth interface and get to where they want very quickly with much less work. So, I mean, it's obviously a different example, but it's just kind of timely. It sounds to me like it was almost the same goal. Right? They were trying to make it probably easy for journalists or for their own staff or something to find dirt on the opposition, but it isn't nearly as nice a goal as what you had. But it sounds like the same sort of utility, that it's a step, it's an enabler for people to less time and effort to do better, getting the relevant information for what they're.
For sure. It's really it's a tool for finding the relevant evidence. And it was initially thought as a tool partly for funders. So if they want to commission research, don't commission research where you've already got piles of research, but or commission the research but extend it, right, to get the outcomes that people really want to know about. So
can I clarify that? A tool for funders to commission systematic reviews
or primary studies.
The two.
And then as we developed it in that frame, realized that policymakers would really like to have this for making decisions about policies. So it's really like a findability tool. Because it doesn't do a whole lot of analysis.
Utility or something.
It's almost like a scoping review, what's available.
So people might want a user, like I'm thinking of it as a researcher,
Yeah.
but you might want to be pinged, you might want to be told if there's an update in the areas of interest to you. Kind of cool if you could get an email saying, you know, go to our site because we've added a new review or something.
That would be good, yes. That's a new functionality. So Campbell has just gone through a tender process for a web developer for the actual web version. The applications came in, I think, last week or something. I'm not part of the selection process, but might be part of the development process. So I'll definitely mention that. Yeah, you could have a sort of user update feature. Yeah.
Something like Google Scholar, you can
Get alerts.
areas of interest and then they,
Yeah. Okay. You guys are giving me all kinds of work from my That's great. Okay. All right. No questions online? I think, Emmanuel, you were about to